Hello, this is Dr. Groover. For the next few minutes, I'd like to talk to you about pain. Now, by far the number one reason patients come into my clinic for treatment is pain. And there are usually misunderstandings about the nature of pain. Patients oftentimes think that pain is a condition in and of itself, and when they do, they're going to look for pain remedies. So the pain remedies are things they rub on the joint or the area of pain, the muscle, or the whatever is hurting. There can be medications that they take. Could be acupuncture, massage, physical therapy modalities. A lot of times they'll try and exercise a joint that is causing pain. And there's some significant problems with these more symptomatic, more topical ways of handling pain or managing pain. One of them is that pain medications have effects that are negative, all right? So you may have relief from pain, but if you're using the pain medication, you want to get off of it as quickly as possible. And the best way to get off pain medication is to get rid of the pain, all right? So if you don't need the pain medication, then, you don't need to take it. I do want to caution you, however, that there's a lot of problems with drug toxicities now and addiction to pain medications. So if you're taking a pain medication, do what you can to get rid of that pain and get off that medication. And remember, these are addictive, a lot of them, and these medications, you may require professional help to take yourself off, okay? So the other thing is that living with your pain is a really bad idea because it wears down your system. All right, what does it wear down? Well, there have been indications that a person who lives with low back pain for 1 year has 15% less gray matter in their brain. I can tell you from observing patients that long-term chronic pain can cause depression, anxiety, nervousness, problems with cognition. There's a lot of bad things about living with pain. So if you have pain, you want to get rid of it as soon as possible. Now, the best way that I have found to get rid of pain is to fix the functional problem that's the source of the pain. So if you have a broken bone or a laceration or something like that, of course, get those things fixed immediately because those are really can be life-threatening and can certainly, over the long run, cause a lot of disability. Now, by far, the biggest cause of pain in our office is the abnormal functioning of a joint. So when a joint does not function properly, that means that it's not lined up properly, it's stiff, it's weak, it's inflamed. There's a lot of things that happen to cause a joint to function incorrectly, but for the most part, a joint will function properly if it's lined up and it's traveling in its proper track. Now, when a joint misaligns, you're going to have the mechanical problem that causes chafing and grinding and stretching and compressing of tissues in the joint, and long-term chronic wear and tear that leads to degenerative arthritis of the joint. Okay, so there's that mechanical problem, which then leads to a neurological problem because there are joints, all the joints are associated with nerves. And typically the nerve associated with that joint will be in serious trouble, usually under a constant pain stimulation. All right, now the other thing that happens is when a joint misaligns, then you will have neurological inhibition of the muscles that operate that joint. So you'll have that muscle weakness factor in the way that the joint is functioning. There are a lot of other ways that joints can misfunction, but those are the primary ones that we see. So a poorly functioning joint is usually going to have a mechanical, neurological, and also a circulatory abnormality, muscle weakness, and pain, of course, inflammation and pain. So you want to get your joints lined up. And the problem with joints can cause pain all over your body. And if you have multiple joint misalignments, you may even think that you have some condition of terrible myalgia or fibromyalgia or something like that. So get yourself assessed properly, get some really thorough diagnostic work done by a qualified professional, and get this treated properly. Now, the treatment usually involves physical manipulative procedures in the direction of normal joint function, which is a joint corrective procedure. Also, then there's a need, once the joint is lined up, there's usually a need to resolve the neurological problems and the muscle problems and reduce the inflammation and allow the tissues to heal, and with exercise, allow the joint to strengthen in its newly aligned position. So now, if we can help you in any way, if I can be of service, just give us a call. We offer a complimentary, a free initial evaluation, and it's a very good evaluation. That's the report that we get from most patients who go through this procedure. They're going to find out things that probably no one has ever told them before. And so give us a call and stop by for a little while and visit with us and get a screening evaluation from me. And I can tell you what's wrong, what's causing your joint problems, generally speaking, and give you an idea of how we would treat these things and what kind of results you should expect in what period of time. And I'll tell you, for the most part, my patients who come through my front door the first time experiencing pain, usually after the first few treatment appointments, their pain symptoms have reduced dramatically, and we're really surprised if a patient still has pain after 1 month. So good health and good life, and take care.